Hi, I'm Dr. Chris Lewis, one of the chief educators here at Doctors in Training, and I want to welcome you to the Solid Anatomy lecture on cranial nerves. In this video, we'll be covering a brief description of the nervous system, the functional classification of the cranial nerves, and then cranial nerves, specifically 1 through 6 and their function. Cranial nerves 7 through 12 will be discussed in another Solid Anatomy lecture. Now, I'll be back later for a clinical correlation and the end of session quiz, but for now, I'm going to turn it over to our primary lecturer, Dr. John Phelan.
Before we begin our lecture on the cranial nerves, let's briefly review the nervous system. If you've watched the Solid Anatomy introductory lecture, you'll recall that the functional unit of the nervous system is the neuron, or nerve cell. A typical neuron consists of a cell body, where the nucleus is located, and two types of processes that arise from the cell body: multiple dendrites and a single axon. Generally speaking, neurons communicate with one another through a connection between the axon of one neuron and the dendrite of another. This connection is called a synapse. Axons covered by Schwann cells and connective tissue that separates them from other axons are referred to as nerve fibers. A nerve is a bundle of nerve fibers surrounded by connective tissue and the vasculature supplying the nerve. The nervous system may be structurally divided into a central nervous system and a peripheral nervous system. The central nervous system consists of the brain and the spinal cord, while the peripheral nervous system is the collection of nerves outside the central nervous system that conducts impulses to or away from the central nervous system. A peripheral nerve that relays information from the periphery to the central nervous system is said to be afferent or sensory, while a peripheral nerve that relays information from the central nervous system to the periphery is said to be efferent or motor. The mnemonic SAME, S-A-M-E, may be helpful in remembering that sensory nerves are referred to as afferents, while motor nerves are referred to as efferents. The two types of peripheral nerves are spinal nerves and cranial nerves. Unlike spinal nerves, which emerge from the spinal cord and the spinal column, cranial nerves emerge directly from the brain. They are called cranial nerves because they pass through openings in the cranium, or skull. There are 12 pairs of cranial nerves, numbered from 1 to 12 in the order by which they emerge from the brain from rostral to caudal. This also corresponds to the order, from rostral to caudal, in which they penetrate the dura mater in the floor of the cranial cavity. They are referred to by a Roman numeral, and often abbreviated as CN Roman numeral 1, etc., and by a Latin-derived name. The name assigned to each cranial nerve is reflective in some way of their function or distribution. For instance, cranial nerve 3, the oculomotor nerve, provides motor innervation to 4 of the 6 extraocular muscles, the muscles controlling movement of the eyeball within the orbit. Most cranial nerves originate or terminate in the gray matter of the brainstem at collections of neuronal cell bodies called nuclei. The first and second cranial nerves are the exception. They are extensions of the forebrain. Recall that the forebrain is equal to the cerebrum plus the diencephalon. Cranial nerves are said to carry one or more modalities, or functional components. You may see these modalities classified in a couple of different ways. The traditional manner of classification is by a 3-letter system. The first letter is either G for general or S for special. General refers to types of neurons found in spinal and cranial nerves, while special refers to types of neurons found only in cranial nerves. The second letter is either S for somatic or V for visceral. Somatic refers to types of neurons innervating structures derived from somites, while visceral refers to types of neurons innervating structures not derived from somites, which includes organs, glands, and structures, including some voluntary muscles, derived from the branchial arches. During the 4th week of development, a series of 5 ridges called pharyngeal or branchial arches arise on the ventrolateral surface of the embryo. Each arch contains a cranial nerve that supplies the structures that develop from it. For example, muscles involved in chewing or mastication, such as the masseter, are derived from the first branchial arch, which contains the trigeminal nerve. So the muscles of mastication are innervated by the trigeminal nerve, or 5th cranial nerve. And the second letter assigned to the modality associated with that innervation will be V for visceral. Meanwhile, mesoderm, developing on either side of the primitive spinal cord, forms segmented masses called somites, from which the rest of the skeletal muscle and other structures arises. Cranial nerves providing innervation to structures derived from the somites have a modality that will have an S as the second letter in its classification. Here's an example of a structure derived from a somite. The muscles acting on the eyeball, such as the superior rectus, which is innervated by the oculomotor nerve, which is the 3rd cranial nerve. That nerve was not associated with one of the branchial arches, and it innervates a voluntary muscle that is not derived from a branchial arch, but rather from a somite. So one of its modalities will have an S as its second letter. The third letter is either A for afferent or E for efferent. Recall that afferent nerves are sensory, while efferent nerves are motor. This includes nerves that are secretomotor to glands. That is, they cause the glands to secrete fluids that they produce. 7 different modalities are named using this 3-letter system. General somatic efferent, motor to skeletal muscle derived from somites. General visceral efferent. This is the parasympathetic component of the cranial nerves. If you've watched the Solid Anatomy introductory lecture, you may recall that the nervous system may be functionally divided into a somatic nervous system and an autonomic nervous system. The autonomic nervous system, which is associated with involuntary visceral function, like heart rate and glandular activity, can be further divided into a sympathetic and parasympathetic system. The sympathetic system may be described as a thoracolumbar system because it arises from the thoracic and lumbar segments of the spinal cord. The parasympathetic system is described as craniosacral because its nerves come from the sacral level of the spinal cord and the brain. The cranio part of the parasympathetic nervous system are the preganglionic parasympathetic fibers that leave the brain through cranial nerves 3, 7, 9, and 10. These fibers synapse at one of 4 parasympathetic ganglia found in the head outside the cranial cavity. The postganglionic parasympathetic fibers then continue to smooth muscles such as the constrictor pupillae, which constricts the pupil. Special visceral efferent, motor to skeletal muscles derived from the branchial or pharyngeal arches. Why is this considered visceral? These muscles develop in association with the pharynx, which is considered part of the gut. Why is this special? Viscerally derived structures are generally not voluntary. The only nerves providing voluntary motor innervation to any structure derived from the gut are the cranial nerves. General somatic afferent. Sensory to structures derived from the somites. Touch sense to skin and mucosa, and proprioreception to muscles and tendons. Through proprioreception, changes in joint position may be sensed through stretch receptors in the muscles and tendons and result in appropriate changes in muscle contraction. General visceral afferent. Sensory to internal organs, blood vessels, and glands. In other words, sensory to the viscera. Special somatic afferent. The special senses of sight, hearing, and equilibrium. Special visceral afferent. The special senses of smell and taste. These are classified as visceral because of the functional association between these senses and the viscera of the gastrointestinal tract. This traditional classification system is still widely used. However, here's a warning. Embryological studies over the last 20 years have shown that all voluntary muscle actually is derived from the somites, so the special visceral efferent classification is erroneous. Thus, the two motor components of cranial nerves are really the same as any other peripheral nerve: somatic efferent and visceral efferent. Cranial nerve 1, the olfactory nerve. The olfactory nerve has only one modality: special visceral afferent. It is responsible for the sense of smell. Its cell bodies are not found in the gray matter of the brainstem like most of the cranial nerves, but rather in the mucosa of the superior part of the nasal cavity. The dendrites of each olfactory neuron are covered with cilia bearing olfactory receptors on their surface. When enough odorant molecules bind to these receptors, an impulse is triggered. The axon of each of these olfactory neurons passes through the cribriform plate of the ethmoid bone to get to the olfactory bulbs in the anterior cranial fossa. These axons synapse in the bulb, and secondary axons travel through the olfactory tracts to the cerebrum. The olfactory bulbs and tracts are considered extensions of the forebrain, which is why we are calling the bundles of axons running from the bulbs to the cerebrum tracts instead of nerves. Cranial nerve 2, the optic nerve. The optic nerve's only modality is special somatic afferent. It is the nerve of the special sense of vision. The optic nerves develop as evaginations of the diencephalon. Thus, they are extensions of the forebrain and considered to be tracts of the central nervous system. They are surrounded by extensions of the cranial meninges, the dura mater, arachnoid mater, and pia mater, and there is cerebrospinal fluid in the subarachnoid space surrounding the nerve, just as there is in the brain. The meninges extend to the eyeball. The cell bodies of the optic nerves are located in the retina, which is the innermost layer of the eyeball. Light entering the eye activates photoreceptor cells of the retina called rods and cones. These transmit electrical signals to cells of the retinal ganglion. Axons of retinal ganglion cells pierce the sclera, the tough outer covering of the eyeball, become myelinated, and combine to form the optic nerve. The nerve passes posteriorly through the optic canal to reach the middle cranial fossa. The right and left optic nerves join to form the optic chiasm in the region of the sella turcica of the sphenoid bone. The nerve structures continuing posteriorly from this point are called the optic tracts. At the optic chiasm, the axons from the medial half of the retina decussate, or cross the midline, to reach the optic tract of the opposite side. The axons from the lateral half of the retina continue posteriorly through the ipsilateral optic tract, that is, the optic tract of the same side as the nerve. The axons in the tracts terminate in the visual processing centers in the diencephalon and the midbrain.
All right, welcome to another clinical correlation. In these cranial nerve lectures, we'll be discussing how to test cranial nerves. So let's briefly go over and learn how to perform the physical exam for the cranial nerves that we've just discussed. So we're going to do cranial nerve just 1 and 2. So first, on cranial nerve 1, this is the olfactory. Now, often we don't test this one because not many of us carry around orange peels in our white coats. And if you did have something to smell, then have the patient close their eyes, then close off one nostril at a time, and have the patient sniff. And then repeat the process for the other side as well. Now for cranial nerve 2, this is the optic nerve. So we're going to test visual acuity with an eye chart test. Also, you want to check the visual fields by what's called confrontation. So you're going to stand in front of the patient, ask them to look you straight in the eyes, and then you're going to hold out your fingers to the outside and then slowly bring them in different locations. And you're going to ask them to see, well, when do you see them coming into your peripheral view? All right, guys, let's answer a few of these questions for these cranial nerves. Which cranial nerve is associated with visual acuity? Easy. Cranial nerve 2, that's the optic nerve. Next question. Other than visual acuity, what else should be tested in order to evaluate cranial nerve number 2? Remember, those are the visual fields coming from the outside in. All right, guys, let's get back to that lecture.
Cranial nerve 3, the oculomotor nerve. The two modalities of the oculomotor nerve are general somatic efferent and general visceral efferent. It provides motor innervation to 4 of the 6 muscles that move the eyeball and a muscle that raises the eyelid. Additionally, it provides parasympathetic innervation to a muscle that constricts the pupil of the eyeball and a muscle that acts on its lens. Its somatic nucleus and its parasympathetic nucleus, which is sometimes called the Edinger-Westphal nucleus, are found in the midbrain. The oculomotor nerve emerges from the midbrain and runs through the lateral wall of the cavernous sinus. It passes through the superior orbital fissure and bifurcates into a superior and inferior division. The superior division innervates the levator palpebrae superioris muscle, which raises the upper eyelid, and the superior rectus, which is involved in elevation of the pupil when the eye is abducted. The inferior division innervates the medial rectus, which adducts the pupil, the inferior rectus, which depresses the pupil when the eye is abducted, and the inferior oblique, which elevates the pupil when the eye is adducted. The inferior division of the oculomotor nerve also carries the preganglionic parasympathetic fibers to the ciliary ganglion, which lies anterior to the optic nerve. The preganglionic parasympathetic fibers synapse at this ganglion, and the postsynaptic fibers run in the short ciliary nerves to enter the eyeball. The postsynaptic parasympathetics innervate the ciliary body, which reduces tension on the lens when it contracts, making the lens more convex and thus accommodating it for near vision. The parasympathetics also innervate the constrictor pupillae muscle, which constricts the pupil. Cranial nerve number 4, the trochlear nerve. The only modality of the trochlear nerve is general somatic efferent. It provides motor innervation to the superior oblique muscle, which depresses the pupil when the eyeball is adducted. Its cell bodies are in the trochlear nucleus in the caudal part of the midbrain. It is the only cranial nerve whose fibers originate entirely from the contralateral nucleus. They decussate prior to emerging from the brainstem at the junction of the pons and midbrain. Thus, if the nucleus is damaged, the contralateral superior oblique muscle is affected. But If the nerve is damaged, the ipsilateral superior oblique muscle is affected. Other unique features of this nerve are that it is the smallest of all cranial nerves, and it is the only cranial nerve that emerges from the posterior surface of the midbrain. It pierces the dura mater just inferior to the oculomotor nerve and runs with it through the lateral wall of the cavernous sinus and through the superior orbital fissure to reach the orbit. It then enters the posterior part of the superior aspect of the superior oblique muscle. The trigeminal nerve has separate motor and sensory roots. The larger sensory root is entirely general somatic afferent. The modality associated with the smaller motor root is branchial motor, or special visceral efferent, to muscles that develop from the first branchial or pharyngeal arch. The cell bodies of the sensory fibers of the trigeminal nerve are found in the trigeminal ganglion, which lies flat on the temporal bone in the medial part of the middle cranial fossa. You may recall that a ganglion is a collection of cell bodies of neurons in the periphery, as opposed to a nucleus, which is a collection of cell bodies in the central nervous system. There are no synapses in sensory ganglia such as the trigeminal ganglion or any other sensory ganglion associated with a cranial nerve. The neurons of the sensory ganglia are of the same classification as the neurons of a dorsal root ganglion of a spinal nerve. They are pseudo-unipolar neurons. They have an axon that bifurcates into a peripheral process and a central process. The peripheral process carries a signal from a sensory organ in the periphery to the ganglion, and that signal continues through the central process to the central nervous system where it synapses at a nucleus. The central processes of the sensory neurons enter the pons and terminate in the trigeminal nuclei. The motor nucleus of the trigeminal nerve is also found in the pons. The sensory and motor roots enter and exit the lateral pons at about the same location posterior to the olive. The trigeminal nerve pierces the dura mater just anterior to the tentorial incisure near the crest of the petrous portion of the temporal bone and enters the middle cranial fossa. The trigeminal ganglion is located on the floor of the fossa just anterior to the crest of the petrous portion of the temporal bone. Distal to the ganglion, the sensory root, which at this point is made up of peripheral processes of the sensory neurons, branches into three divisions, which are abbreviated V for Roman numeral 5, superscript 1, V2, and V3, and are named the ophthalmic, maxillary, and mandibular divisions. The motor root passes inferior to the ganglion without synapsing and follows the mandibular division, the only division carrying motor fibers. The ophthalmic division runs in the dura mater of the lateral wall of the cavernous sinus. Just prior to passing through the superior orbital fissure, it divides from lateral to medial into the lacrimal, frontal, and nasociliary nerves, which traverse the superior aspect of the orbit. The lacrimal nerve and the nasociliary nerve give branches that provide touch sense to the lateral and medial halves of the eyeball, respectively, and are involved in the corneal reflex. Touching the cornea evokes a reflexive blink of the eyelids. The lacrimal nerve passes through the lacrimal gland and provides sensory innervation to it. The postganglionic parasympathetic fibers providing secretomotor innervation to the gland follow the lacrimal nerve to the gland, but the parasympathetics originate not from the trigeminal, but rather from the facial nerve. The lacrimal nerve continues anteriorly through the orbital septum to innervate skin on the lateral upper eyelid. The frontal nerve runs along the superior margin of the levator palpebrae superioris muscle and bifurcates distally into a supraorbital and supratrochlear nerve. The supraorbital nerve passes through the supraorbital foramen, or notch, of the frontal bone and provides cutaneous innervation to the middle of the eyelid and most of the skin of the forehead and scalp. The supratrochlear nerve passes superior to the trochlea, the tendinous pulley through which the tendon of the superior oblique passes, and innervates the skin of the medial eyelid and central forehead. The nasociliary nerve branches into ethmoidal branches, the long ciliary nerve, and the infratrochlear nerve. The ethmoidal branches run medially through the ethmoid bone to innervate mucosa of the anterior nasal cavity. The long ciliary nerve provides touch sense to the medial half of the eyeball. The infratrochlear nerve runs anteriorly, passes inferior to the trochlea, and innervates skin on the medial edge of the upper eyelid and over the bridge of the nose. The maxillary division also runs in the dura mater of the lateral wall of the cavernous sinus. Before entering the foramen rotundum, it gives off a meningeal branch that is sensory to the dura mater on the cranial floor. The foramen rotundum leads the maxillary division to the pterygopalatine fossa, where it gives off nasopalatine, palatine, and zygomatic branches. The nasopalatine and palatine branches travel inferiorly to innervate mucosa of the palate. The zygomatic branch, which carries postganglionic parasympathetic fibers destined for the lacrimal gland, enters the orbit through the inferior orbital fissure. It divides into branches that pass through the zygomatic bone to innervate skin over the temple and the cheek. The maxillary nerve also continues into the orbit via the inferior orbital fissure and enters the infraorbital groove on the orbital floor, which leads to the infraorbital canal. As the maxillary nerve, at this point often called the infraorbital nerve, passes through the maxilla, it gives off superior alveolar branches that are sensory to the superior or maxillary teeth. It then exits the infraorbital foramen as the infraorbital nerve, which provides cutaneous innervation to skin of the lower eyelid, the nose, and the upper lip. The mandibular division, which includes the motor root of the trigeminal, exits the middle cranial fossa through the foramen ovale, which leads to the infratemporal fossa. Here, the mandibular division gives off 5 sensory branches and motor branches to 8 muscles. A popular mnemonic for the sensory branches of the mandibular division is Malibu. The meningeal branch leaves the infratemporal fossa by passing through the foramen spinosum to innervate the dura mater of the middle cranial fossa. The auriculotemporal nerve travels posteriorly and then superiorly to innervate skin anterior to the ear on the lateral head. The lingual nerve runs anteriorly and inferiorly to reach the anterior 2/3 of the tongue, where it provides general sensation. The chorda tympani nerve, a branch of the facial nerve that will be discussed subsequently, joins the lingual nerve in the infratemporal fossa and follows it to the tongue. The inferior alveolar nerve travels inferiorly and passes through the mandibular foramen on the medial side of the ramus of the mandible, passes through the mandibular canal, gives off sensory branches to the mandibular teeth, and exits the mental foramen on the body of the mandible as the mental nerve. The mental nerve innervates the lower lip and skin over the mandible. The buccal, or long buccal nerve, runs anteriorly and inferiorly towards the buccinator muscle of the cheek. It gives off branches that innervate the skin over the cheek and branches that pierce the buccinator to provide sensory innervation to the mucosa of the oral cavity. The 8 muscles receiving motor innervation from the mandibular division of the trigeminal nerve are the temporalis, the masseter, and the lateral and medial pterygoids. 2 muscles innervated by the mylohyoid nerve, the anterior belly of the digastric muscle and the mylohyoid muscle. And 2 tensor muscles, the tensor tympani of the middle ear and the tensor veli palatini of the palate. Cranial nerve 6, the abducent nerve, sometimes referred to as the abducens nerve. The 6th cranial nerve has one modality, general somatic efferent, to one extraocular muscle, the lateral rectus, which abducts the eyeball, hence the name of the nerve. Abducens is Latin for lead away. The abducens nucleus is in the pons. The nerve leaves the brainstem at the junction between the pons and the medulla. It follows the longest intradural course of any cranial nerve. The abducens nerve runs superiorly until it reaches the level of the cavernous sinus. It then enters the sinus, traveling not in its wall like the other nerves innervating extraocular muscles, but actually through the sinus, bathed in venous blood, to reach the superior orbital fissure. The nerve passes through this fissure, penetrates the annulus tendineus, and innervates the lateral rectus muscle by penetrating its medial surface.
All right, welcome back. Let's continue our discussion on how to test cranial nerves. So cranial nerves 2 and 3, I know we talked a little bit about cranial nerve 2 already, but let's put it together with 3. Now, so you'll notice that some of these do have kind of crossover. Now, in this one, when you're testing cranial nerve 2 and 3, you're going to inspect the size and the shape of the pupils, and you're going to test pupillary reactions to light. For cranial nerves 3, 4, and 6, so this is oculomotor, trochlear, and abducens, you're going to test the extraocular movements in these 6 cardinal directions of gaze. So you're having them look at your finger and you're moving it in all the different directions. So for cranial nerve 5, this is trigeminal, here we're testing facial motor function. So palpate the temporal and the masseter muscles while asking the patient to clench his or her teeth like this. And then you also want to test for sensation. You can do this with a wisp of cotton, lightly touch it on the face and ask them if they can feel it or if it at least feels the same on each side. Okay guys, so that covers cranial nerves 1 through 6. Now we'll cover the others in the next lecture, but let's go ahead and do a couple of questions. Now, which cranial nerves are being tested when the patient is asked to look in these 6 cardinal directions during a physical examination? Remember, that's cranial nerve 3, 4, and 6. Next question. Inspection of the pupils will help evaluate which cranial nerves. Remember, that's going to be cranial nerve 2 and cranial nerve 3. So that covers the cranial nerves 1 through 6 lecture. Now I want you to pause the video and answer the end of session quiz questions. Now there's going to be some questions covered that were not discussed in the lecture. Just do the best you can, then we'll go over those answers together. All right, let's get going. Which nerve supplies sensory innervation to the face? That's going to be the trigeminal nerve. Next, which nerve innervates the muscles of mastication, so chewing? That's going to be the mandibular division of the trigeminal nerve. Next, what is the only cranial nerve arising from the dorsal aspect of the brainstem? That's going to be the trochlear nerve. Next, which cranial nerve is responsible for communicating motor information to the lateral rectus muscle of the eye? That's going to be the abducens nerve, number 6. Next, which cranial nerve is responsible for communicating motor information to constrict the pupil? That's going to be the ocular motor nerve, cranial nerve 3. Next, Which cranial nerve is responsible for communicating motor information for accommodation? So that's focusing by changing the shape of the lens. That's going to be ocular motor nerve, cranial nerve 3. Okay guys, we're almost done. Now we've provided again some images for you to label. Recalling these images and a time setting will help you perform well on the practical part of your exam. So label the images and then we'll be finished. Thanks a lot.